Hello, are you frustrated because your patients find it difficult to walk throughout the healthcare system? You see a patient and you prescribe a medication, but the patient never gets it. Perhaps you refer a patient to see a specialist, but you are not sure if the proper services were provided. Do you receive feedback from the providers to whom you refer your patients? In summary, is the healthcare plan that you have designed for your patient being coordinated among the different entities or services to which you frequently refer? I am pretty sure that your answers are going to be yes, you are frustrated, no, you do not receive feedback from other providers, and no, the healthcare plan for your patient is not being coordinated. To solve these problems, we need care coordination. I am Dr. Angel Braña. This is the first of a series of podcasts about care coordination. This is a concept that will help you in addressing the difficulties of moving throughout our fragmented healthcare system. After this presentation, you will be able to define the term care coordination and describe the care coordination ring model. Care coordination is the systematic approach to organize patient care activities between two or more participants or entities to facilitate the appropriate delivery of healthcare services to a patient. Care coordination includes all the activities that ensure that the patient's needs and preferences are met over time. Let's see the care coordination ring model. The central goal of care coordination is shown in the triangle in the middle of the diagram, meeting patient needs and preferences. The color bubbles in the periphery represent the principal departments, programs, and services where care is provided to patients. For example, primary care clinics for adults and children, inpatient, emergency and specialty care, long-term and home care, community resources, informal caregivers, laboratory, medications, dental and mental health, and school-based clinics. The blue ring connecting the color bubbles is care coordination, namely any activity or process that bridges the gaps, the gray spaces, along the care pathway. At each side of the triangle, you'll see one group of stakeholders of the healthcare system that will provide their very particular perspective of successes and failures in care coordination. The patient and the family, the healthcare professionals, and the healthcare representatives, usually the governing entity of the institution. Who's in charge of the healthcare coordination? Care coordination is a function of the healthcare team. The doctor does his or her part by writing a clear healthcare plan. Nurses do the care coordination, explaining the care plan, calling other providers on behalf of the patient, and facilitating referrals. And the front desk staff coordinates care, maintaining good communication with the patient. Some patients need more intense support. The drug addicts, the homeless, and patients with complex diseases like hypertension or difficult to manage like diabetes mellitus. In these cases, a clinical case manager would do much of the care coordination and will be concerned with all aspects of the patient's physical and social environment, psychological and psychiatric needs, transportation, and social network. Care coordination, the systematic approach to organize patient care activities between two or more participants or entities to facilitate the appropriate delivery of health care to a patient. A systematic approach. On the one hand, you have a clinical settings and patients, and on the other, coordinating mechanisms. If they get a good fit, then you'll have effective, efficient care coordination. Care coordination is not easy, but it can be done, or else your patients will return complaining that they have not been able to follow the healthcare plans you recommended. I hope that this presentation helped you better understand care coordination. Can you think of examples or situations in which the departments, services, or programs in your clinic had difficulty in coordinating the healthcare of your patients? Which departments, services, or programs do you foresee having more difficulty coordinating healthcare for your patients? Now, please go to our discussion forums and create a brief example of a time when one of your patients experienced problems in coordinating care and a short description on how you would handle the situation now using the care coordination approach. I look forward to our discussions. Thank you.